Dr. Labi, hey, how are you?
I'm fine. Hi, Jennifer. How are you?
I'm amazing. I am just so thankful that you've worked a very long day and you're donating time and to help patients. Before we get started with this really important topic, which is COPD and COVID, I want to give you a moment just to introduce yourself.
Wow, that's kind of you. So my name is Fortune Alabi. I'm one of the doctors at Florida Lung Asthma and Sleep Specialist. We have four locations. I'm actually at the Polynesia in Kissimmee location right now. I've been there all day. It's been a long day. And then we also have an office in Orlando, on Michigan. We have an office in the west side of town, in Winter Garden. And then we have an office also in Ponciana.
Very good, very good. So let's just dive right in. We're talking about COVID with COPD. We're all in a pandemic. Even for people that don't have COPD, anxiety levels are high. People are nervous and trying to prevent getting this disease. But when you have COPD, it's even more important, right? So the first question is, how can COPD patients protect themselves from getting COVID?
Yeah, that's a good question. When the pandemic started, the first set of patients that we saw in the office, people are worried, just like you rightly said. They have underlying lung disease, and we know that vast majority of people with COVID-19, if they die from respiratory issue, right? Vast majority of them. And so the question comes up, am I at risk? Am I at risk? Am I at risk? And then we told them at the time, that of course you're at risk if you have it. But now, almost a year into COVID-19, a year into the pandemic, I think we know a little bit more now. We know that COPD itself is not a risk factor, unlike diabetes, high blood pressure, immunosuppression, and age. And COPD by itself is not a risk factor, but COPD or any of the other respiratory condition is a risk factor for bad outcome. So if you do get it, right, you might have a bad outcome. So that's why it is so important that if you have any underlying lung disease, you should protect yourself, not because you're at an increased risk of getting the COVID-19, but if you do get it, your chances of not doing well is way higher. And so that is why it's very imperative that somebody with any lung disease, and COPD happens to be the most common, they have to protect themselves, very,
So
very well.
like, protecting themselves is part of like what you've all you educate every day. Take your maintenance medication, keep your appointments, stay diligent with your managing your COPD. But as far as a vaccine, do you recommend as a preventative that your patients get the vaccine to prevent COVID?
Of course. I mean, you know that so I got mine. I think I got mine almost maybe 6 weeks, 4 weeks. I can't even remember exactly when, but I think I should be one of the fourth set of doctors that volunteered to say, we're going to get the COVID-19. And what we did to encourage our patient was, we took up the video, we actually took pictures of ourselves, the providers taking the vaccine, because there's a lot of fear, which is understandable, of the unknown side effect of the vaccine, and people have legitimate reason, valid reason, for them to have some level of hesitation. So we felt that the best thing we can do, since we understand the science a little bit better and we follow the process of the drug development a little bit better than our average patient, we felt that we have to show them, not just tell them to do it, but also show them that we did it. So we put this on our Facebook, just to show them that we got the vaccine and we're doing well. And it's something that we have to reinforce every time they come into the office. But the good news is this: I can tell you that vast majority of my patients, vast majority of them are 65 and older, they've received it. And even those of them that they've not received it, they're looking for it,
Yeah.
right? So I think this is just a wonderful news. I feel very, very happy about it.
That is so good that you're relieving the anxiety, because I know there's a lot of mixed feelings with it, but when it comes down to it, to build that immunity and have that protection is so much better than the other, right?
That's true.
So
That's true.
patients, and the science is difficult to understand. So the fact that you're actually showing them is so relevant and so important that you're willing to, I'm taking the vaccine, you know? So that's awesome. Thank you, Dr. Marty.
And also the kit, and also I also tell the patient that they received it, right? They need to tell some of their friends. They
Yes.
need to tell their family, right? So it's not, you know, to fight this virus, it's not just the what the healthcare people can do alone. Everybody, all hands on deck. You know, these, if we want this virus to go away and if we want to go back with our normal life, whatever that normal life used to be, everybody needs to be involved, you know. And so I educate you. I told you I've done it, you've done it, tell somebody else you've done it and tell them how you feel, at least some of their concern. And hopefully, you know, with time, maybe the virus will be something of history. We'll see.
Yes, I certainly hope so. I certainly hope so. So, the second question, and hopefully, if everyone gets vaccinated, we won't even have to answer this question. But I mean, obviously, prior to the vaccine, we've got, you know, COPD patients that have been diagnosed with COVID. You know, how can the patient, when they've been diagnosed with COVID, manage COPD and still overcome the virus? I mean, do you have like anything that you, any insights that you could give?
Yeah, so you know, we always tell them even before you get, hopefully you won't get it, right? Because COPD, you know, the other point that I wanted to stress, which I forgot from the first question you asked me, is the risk factor also. You also have to remember that vast majority of people with COPD, they are in their 60s and 70s. So age, apart from comorbidities of diabetes by itself, so not just the COPD that is going to predispose them to it. So the age itself is going to make them more vulnerable to COPD, and the COPD is going to make them have a bad outcome. So that is the reason that most COPD patients have to do whatever they can, mask, which they've done, and now there's vaccine, they need to jump on it and get the vaccination. So now going back to your question, if they do get it, right? So you know, there's also this misconception, you know, at the onset of the pandemic about, oh, do we keep using our inhalers? You know, there's all kinds of stuff on the people are spreading out there. Oh, don't take your inhaled steroid. Oh, don't use it and don't use that. People come to us and say, hey, should I stop taking my medicine? You know, inhaling steroid into my lung, does that, you know, unnecessarily place me at the high risk of getting the virus? And then we tell them, just continue with your medicine. Don't stop anything. You want your lungs to be well optimized, right? This is not the time that you want your weak lung, because your weak lung is not going to be able to fight the virus if you do succumb to it, right? So we want to make sure that even before you get it, use your medicine the way you normally done it. And then if you do have it, right? So most of my patients, I tell them to call me, you know, call your doctor. You're not the type that we just want to stay home, because I've like I said earlier, COPD might not be a risk factor. Their age by itself is a risk factor. And because of the underlying lung disease, they are most likely, or they have a, you know, a higher probability of having a bad outcome. So these are people, you want to call your doctor. You want to make sure, do I have to stay home and monitor myself? You have to check your oxygen saturation. You know, and if you're not feeling well, you have to go to the hospital on time to just make sure that you are being monitored and see if you would be a candidate for treatment. There are medicine, monoclonal antibodies that can be given, you know, for patients that are high risk to be able to stop the process of the progression of the disease on time. So you want to make sure you call your doctor on time. We have some medicine that we do give patients in the hospital, like remdesivir and some, you know, steroid. So if you have underlying lung disease, continue to use your medicine. Hopefully you don't come down with COVID-19. And if you do come down with COVID-19, get in touch with your doctor on time. Okay. And if you're not feeling well, please go to the hospital.
Absolutely. Well, you're going right into the next question because you said, you know, if the symptoms get worse, go to the hospital, call your doctor. So let's just give patients an idea like, okay, I'm COPD, I've been diagnosed with COVID, I'm taking my medicine, but I'm starting not to feel good. Like, what are the signs and symptoms that should really trigger, okay, 911 or go to the emergency room and really because with these patients, they're more severe and more susceptible, so they have to stay on top of their disease, right? So what
Yeah.
can you say about the signs and symptoms that they really need to pay attention to, and even their caregivers, so that they can know, like, this is the time to act?
Yeah. So in general, so I'm going to answer that question in two parts, right? So I'm sure there might be some other people watching that they do not have COPD. So just like any other person, like this is what we tell our patients, if you have COVID-19 or you have any symptoms that led to you being tested for it, if you're doing well, loss of taste, body aches, headaches, back pain, take some medicine at home, you'll be fine. But once you start having respiratory involvement, that's where the game is a game changer, right? Especially we tell them ahead of time, check your saturation. You have the oximeter, put it on your finger, check it. If the numbers are more than 94, you're fine. If you start seeing low numbers, then you might be heading into some danger zone. And then also, if you're having more trouble breathing, go to the hospital.
Absolutely.
Now, to make it even more difficult is the patient with COPD, because at baseline, they have trouble breathing, right? So some of them, they have, they are limited by activities. They have some difficulty breathing. And two, some of them are on oxygen. So how will you tell if your oxygen is going down? Because you are using oxygen. And so that's the reason I said earlier on, for my COPD patient, I have a very low threshold for them to go to the hospital. You have COPD, you have bad lungs, for some reason you have symptoms and you get tested and it's positive, call your lung doctor. Just call them and tell them what's going on. Because for those patients, I recommend for them to get, there's a bunch of cocktail, at least there's two main cocktail out there that if you give it to those patients, you could stop the disease progression, right? Like the one that the president got, right? So you give it the Regeneron or whatever it's called, and they have different names. There are two main types out there. So for my patient with COPD, elderly people, I don't waste time at all. If they, very low threshold, to get them to the hospital to see them or connect with them on televisit and see how they're doing, monitor their oxygen. If they're not feeling well, call me, go to the hospital.
This is awesome. So if patients stay on top of it, if they have COPD and they stay on top of it with COVID, especially if they know the symptoms and they go to the hospital and they get that cocktail like you're talking about, their chances of recovery are really good, right?
Very good, actually, very good.
And that's the whole thing, is that's the message we want to give people. Manage your disease, know your risk factors, know your symptoms, protect yourself. But
Exactly.
also, if you do the right things and go to the hospital when you're supposed to, when you have those signals and those symptoms, then you can have a really good chance of surviving this.
That's true. That's exactly true. Because once the disease, is fully established and you have lung injury, there's very little we can do. So that's the reason that, you want to make sure you're very ahead of the disease, right? Before you start feeling worse, you want to make sure we do something on time, not coming like 10 days later, full blown pneumonia. You need tons of oxygen, you end up on the respirator, then the outcome is terrible at that time.
Dr. Labby, you have given patients and just everyone so much information. I
Thank
just want
you.
to really thank you for your time. I know you've had a very long day, but your passion for these patients and to educate them is really impressive. So I just want to thank you with
Thank you
everything.
very much. Thanks for having me. And thanks for what you're doing. I'm sure a lot of my patients will benefit from it. So thank you very much.
You're so welcome.
You're welcome. Take care.
Take care.